Hello, everyone. Welcome to Lakewood Health System's Be Well Videocast. My name is Matt Jensen, Director of Marketing here at Lakewood Health System. Today, we're going to be discussing some of the current access available at Lakewood clinics and some of the safety precautions that we have in place to help ensure patient safety. We're also going to be talking about some of the innovative new options at Lakewood available to us to help deliver that care. And then finally, we're going to be talking a little bit about in the wake of Governor Walz's recent announcement last week to loosen up restrictions on elective procedures. What does that mean at Lakewood, and what should patients look for in regard to that? And helping me discuss all of these things today, joining me today is Dr. Christine Albrecht. She is a family medicine provider here at Lakewood Health System. Dr. Albrecht, welcome, and thank you for joining me today.
Well, thanks for having me, Matt. I appreciate the opportunity to help answer some questions.
Perfect. All right, my first question today, Dr. Albrecht, as you certainly know, there's certainly some anxiety out there that we're hearing about and that we experience from patients surrounding COVID-19 and the idea of actually coming into the healthcare clinic right now. It can be a little bit scary. Can you talk a little bit about the access that's available at the care clinics right now? And then also, what are some of the safety precautions that we have in place right now to help ensure that patient safety?
Absolutely. So we have our Pillager, Browerville, and Staples Clinic completely open. We have providers available to see people every single day. We are seeing our well people in the Browerville, the Pillager, and the Staples Clinic, and sick patients who have respiratory symptoms or other possible symptoms of COVID-19 are being seen at our Entrance B clinic on the main campus. And every time you come into the clinic, every single person is going to be asked a list of questions. They're going to have a temperature check, and they are going to be given a mask to wear for their entire time at Lakewood. We know that if everybody is source masking, that helps decrease everyone's risk of infection.
Perfect. Those are exactly the types of answers I think patients want to hear out there today. Secondly, we wanted to talk a little bit about, we still may have patients out there, as you know, that might still be anxious about coming in. One of the neat, new, innovative ways that we're actually able to deliver care right now that Lakewood has just implemented is this idea of virtual video visits. We have loosened up the restrictions. We now have the ability to do that at a rural healthcare system like ours. Talk a little bit about what are these like? How would a patient actually go about setting one of these up? And then why is this a good option for patients right now?
Well, I think that the virtual visits are an exciting new way of technology, and we've been able to really advance this in a quite short period of time. So you could just call a regular scheduling number, just the 894-1515, and talk to the scheduler, and they will help you get set up for a video visit. And if you don't have the ability to do a video visit from your phone or from your laptop and just have phone access, we will do those visits as well. But it is really just so important for us to be able to look at you and see you. And, if you have swollen legs, we can look at that. We can see how your breathing is. So if we can do those video visits, that's by far better. Also, if you're just worried about coming into the clinic and you need some blood work drawn, we do have a drive-up lab opportunity as well. So if you call in advance and you schedule a lab appointment for a drive-up test, that can be done as well. So we're doing everything we can to try to keep everyone safe and everyone as comfortable as possible.
What a great option for patients to have in terms of that drive-up lab ability. That's wonderful. Thanks for sharing that. And then finally, the last question that I wanted to ask you today, Dr. Albrecht, was, with Governor Walz's announcement last week that they're loosening up some of the restrictions around elective procedures, what does that look like at Lakewood Health System? What are some of the plans that we have in place to get that ramped back up? And talk to us about some of maybe the types of procedures that allows us to do. And then also, if there's somebody out there right now that maybe is considering an elective procedure or may want to get into the clinic to at least have a consult, what would they need to do at this point to kind of kick that off?
Well, first thing is, if you've already had a consult with your surgeon and you just got delayed, you were already maybe on the schedule, or they said, hey, call back when you need to have the surgery done when you're ready. Well, we're ready now. So if you go ahead and contact that surgeon that you had initially seen, we can get that on the schedule. If you haven't had a consult, then we need to come see your primary care physician or do a virtual visit to get a referral to see one of those surgeons. We are having everyone come in for their preoperative history and physical, and then getting a COVID swab 5 to 6 days before the procedure to make sure that you're COVID negative when you come in for your procedure. We are having you stay at home and quarantine that entire time after your swab is taken until your day of surgery, just to make sure that you are for sure negative when you're coming in. Then our staff is wearing full personal protective equipment, and we are treating everyone as safely as we can to make sure that we are not increasing anyone's risk here. And I think that we are looking at just gradually increasing our surgery numbers, hopefully close to where they were before. Obviously, some of these things take a little bit longer now as we have extra safety precautions in place. So I think that if you are interested in a vasectomy, which could be done in the clinic, or you're interested in getting your cataracts or a hernia done, just call and let us know, and we will get you to the appropriate person.
So those services are ramping back up. So just to sort of recap, we talked a little bit about access right now. All the clinics are open, seeing patients with the exception of our Motley and Eagle Bend clinic. We also have the ability for patients now to look at video visits as a definite option to get in for care. And then finally, elective procedures are getting back up and running here at the facility. If you have some procedure out there that you may be considering right now or need to get in for a visit on that, certainly feel free to give us a call and make sure that we can get you in to be seen at this point.
That's right, Matt. And the other thing I would just add in your mammograms, your DEXA scans, your colonoscopies, any of those preventative care procedures that we've put off recently, we have opened those back up. We know that COVID is going to be here for a while, and we still need to make sure that we're keeping everyone healthy, as we all know that healthcare doesn't stop because of COVID-19.
Excellent information, Dr. Albrecht. I want to thank you for spending some time with me today. I want to thank the listeners out there today. Everyone, be well and stay safe. Thank you so much.
Thank you. Bye, everyone.
Bye-bye.